So we'll get started. Good day, everyone. My name is Lynn Beauregard. I'm the president of Governance Professionals of Canada. And it's my pleasure to bring you this webcast on governance and HR agility and ensuring continuity in recovery during a pandemic and beyond. Beyond being the key word here, I think there's going to be a lot of discussion about recovery and how this will look essentially when there is a call back to work. So I'd like to thank the University of Guelph and the HR Professionals of Canada for their partnership on this webcast. And GPC wanted to bring you this important discussion as organizations are facing incredible challenges today vis-a-vis their employees. This has been put right at the forefront of the COVID situation, and HR professionals are thrust into very rough waters. So HR and governance challenges become more interconnected than ever, and a shared concern for the entire organization and all boards. So this is a very important discussion, and it is my pleasure to introduce Professor Nita Schinzer, Department of Management at University of Guelph. And joining her as the moderator for this session will be Chris Turney. She is Vice President of Human Resources and Learning for the HR Professionals Association of Canada. So look forward to their discussion, and perhaps Chris, you can take this away.
Absolutely. Thank you so much, Lynn. It's a real pleasure to be here. You know, in preparing for today's webcast and on the news, I've been hearing the phrase, the end of the beginning, a lot over the last few days, referring to the fact that we're really starting to wind down the first phase of our response to this global pandemic and starting to transition into the next phase. And it also definitely implies there's a long way to go still. In the first phase, obviously, we had rapid response, quick decision making, and in many ways, real radical changes to the way our organizations were set up and operated. And those decisions had wide-ranging impacts on our human resources within our organizations. So like never before, the balancing act of business stability and HR risk management has really been tested. And what's more is this balancing act is being amplified in a hyper dynamic and rapidly changing environment. So, you know, you add in things like legal compliance, ethical decision making, adherence to government restrictions and directives, and it's just radical transformation in the world of HR. So, you know, our boards, I think when we're dealing with our boards and governance, it's really those two focus areas of stability and risk management that we want to be sure that we're addressing. So here we are at the end of the beginning, and we're shifting to restarting and recovering our businesses. And so pleased to hear from Dr. Schinzer today, because really, she's going to help us make sense of some of the complexity to our recovering our business, particularly when we think about balancing an evidence-informed approach to how we manage our workforce, a focus on compliance and risk mitigation, and balancing that with strong business acumen. So Nita has a PhD in Human Resources Management from the School of Business at McMaster. And she's also an expert in Canadian human resources management. She's an associate professor in HR management and business consulting at the Department of Management at the University of Guelph. And she also holds an employment law certificate from Osgoode Hall Law School and teaches employment law. Nita is one of those rare individuals as well who not only is she a PhD, but she also holds an MBA and worked in the telecom industry quite interestingly, particularly at Hewlett-Packard and Nortel Networks during the bubble and boom of the early 2000s, which I'm fascinated about Nita. She's an active consultant and advisor in HR and really has her ear to the ground in terms of business. So welcome, Nita. It's wonderful to have you joining us today.
Thank you so much, Chris. I'm really excited because this is a little bit of forecasting and it's a really hot topic. So I think there's going to be a great energy for this presentation.
Yeah, and like I said, I was particularly fascinated with your experience at Nortel in the 2000s. So I wonder, you know, it feels like you've probably gone through some radical business and HR transformation in the past. Can you give us maybe a little bit of history there?
Definitely. So post MBA, I was actually worked in the telecom industry in the 1990s up until the early 2000s. And at that time I worked for Hewlett Packard, and then I moved on to Nortel Networks when Nortel Networks was Canada's darling. Everybody loved Nortel Networks. It could do no wrong. And I was there during the climb and during a very quick demise. And I remained employed after stock started to fall and after the rounds of layoffs happened, until about 2003, actually, at which point I finally put my hand up and said, can I have a voluntary layoff? And with that voluntary layoff, I went back to do my PhD and thought to myself that, okay, so the MBA in me, the capitalist in me, has been indoctrinated into that perspective that management has the right to make strong management decisions to ensure profitability or to ensure organizational sustainability. But then the human component of living through that kind of organizational trauma brought in this idea that we have to make sure the practices and policies that we have in place are actually fair and ethical, and that we're making effective decisions so the organization can recover post-decline. And it's really this big recovery focus, and that's where I've spent the last 16 years of my life researching layoffs, job loss, turnover, employability, all of those interesting factors that are part of this balance between what managers have to do and what HR has to do, and how we can balance both of those competing needs.
Yeah, absolutely. I mean, there's definitely, it is a real balancing act between managing the business and I mean, the people in the organization are absolutely critical. So I wonder, can you share some of your perspectives, I guess, on the shared concerns between governance and HR, particularly at this tricky time?
Definitely. And so I think that I am trying to share a screen. I don't know whether I'm effective with that or not. Can you see my screen?
Yes, we can see it.
Thank you. So I was looking into this for the last little while, and I'm on a couple of board of directors, and I have some history with being a director at organizations. And essentially, there's these fundamental shared principles between governance teams and HR teams. So they're the principles around accountability, transparency, participation, equity, and these principles, they theme into the concept of risk mitigation. They theme into the concept of long-term sustainability of the organization. What's different, though, is that governance is responsible for both internal and external stakeholders. So they have to worry about what some of the external stakeholders, including the clients, the shareholders, have to look at, and what their responsibilities are on that end. Whereas human resource management is largely focused on the internal stakeholders. And by that, I mean largely the employees, past, present, and future, but also the managers and the organization's top management team, including the CEO. They also have the responsibility to balance that up with any union relations or labor relations that might exist through collective bargaining agreements and negotiations at that level. So it's a relatively complex world that HR lives in, but it's a smaller world than what governance lives in. So the focus of today will be focused around responsibilities towards the employee, since that's what's shared. With that in mind, I've organized the presentation to really think about two different themes. The first themes are the structural changes to supply and demand of human resources. And those structural changes are those macro level trends that will impact us not just over the next couple of weeks, but actually over the next couple of years. And then the second theme is balancing the responsibilities we have towards employee wellness as well as business needs. And those are a little bit more short-term, a little bit more operations oriented. So that's how I've themed this.
That's great. I think this will be very valuable information for myself and for the rest of the audience today. So I wonder if maybe you can dig us into the first part and talk to us a little bit about some of the HR related challenges and solutions relative to a COVID-19 business recovery.
Sounds good. So let's put our pulse on what's going on right now. So I updated this on Tuesday, and since then on Wednesday, I think it was actually this morning, BC announced some changes. So anywhere that you see a star, those are the jurisdictions. So these are provincial jurisdictions or territorial jurisdictions that have made announcements about how they're going to ease the restrictions that are in place. We've got some retailers open, we've got some daycares open, we have some restaurants that are allowed to do curbside delivery. There's certain openings that have happened. Parks, museums, in some jurisdictions are open, and in others they are not. So it's very jurisdiction specific. And what you'll see here too is I actually got this from the Times Colonist website, and you'll actually see the rate, how much red there is, demonstrates the rate of infections that have happened already and that have been recorded. So this is a moving target. And what I want to be able to recognize in the audience is that if you have a multi-jurisdictional organization, then you may in fact be open in one province and starting to ease and learn there, but not in another. So you have to be very careful about what those restrictions are. If it's helpful for anyone, I've actually created an Excel spreadsheet to help me make sense of what's open and what's not. And I'm more than willing to share that with any of the participants. But this is something that's changing along the way. So we have to keep our eye on what's opening. Most of what's opened actually happened May 4th. So that's why we've got our finger right on the pulse right now regarding what's going on. Let's talk broad. So I have 3 structural challenges. We'll start with the first one. It's the broadest one. And that's the HR planning challenge. The HR planning challenge for us is that we're now in a situation with high volatility. Just because the government announced that we can actually open up our workplaces doesn't necessarily mean that customers will be returning at the same capacity. And we have to start to estimate demand based on our customer needs. Let me give you an example. Perhaps if barbershops are allowed to be open, then they would see a massive surge in demand right now. And they would have to come up with ways that can increase productivity. So maybe they will come up with better trimming tools, or maybe they have a better process. Maybe they want to add employees and say, well, the barber is no longer responsible for doing the front desk and doing bookings and managing the cleaning. We'll add people who can do that, and then the barber is just exclusively responsible for the area in which they've got the most skills. Maybe we can also extend our office hours or our location hours to deal with surges, because that consumer need in the short term is going to be very high, and then it'll come back down. When we're thinking about estimating our HR supply and demand, we also have to recognize that we don't have control over all of this. We don't have control over the timelines that are established, but I know in Ontario, it was Friday that they announced that as of Monday, certain places could be open. In Manitoba, the announcement was made on a Wednesday, and the places that had to be open, such as restaurants, were scrambling to get themselves ready. So the time to get yourself ready is now. The time to start thinking about how many people do I need to bring back, and in what level do I need to bring them back, and how am I going to get through the sheer volume of work that we might have happens now. I recommend that you use both quantitative or qualitative analysis. Both of these will work well. Quantitative analysis, my suggestion is ratio analysis. So I just finished doing some consulting with a healthcare firm, and that healthcare firm traditionally had 2 front desk workers for 3 doctors, and that was their ratio. During this very complicated time, the front desk workers actually had additional responsibilities, such as being a triage center to figure out whether the client needed to come in, whether they could be telehealthed out, or whether they needed to go to the hospital. So they actually enhanced the role that the front desk was doing, and that increased their work. The traditional ratio was 2 to 3, but given the change in the work, they actually went with a ratio of 1 to 1 and increased the number of front desk workers for every doctor that was employed. And that helped them overcome one of the more immediate surges that they felt. Delphi technique is one of the more popular qualitative analysis techniques. Delphi technique means that you bring in experts. So now's a good time to go back to re-engage the department managers, the supervisors, some of the employees that are being involved, and say, what do you think will happen when we come back? And those people who are on the front line often have the most insightful awareness. They will know that, well, we have our regulars who will come back. I've already been contacted by some people. So getting experts in from your team to have a conversation about what our demand might look like when we come back is quite important. I do recommend that we do scenario planning, and in that case, we think about our best case, our worst case, and our most likely case scenario. Employers also have the option with HR planning to decide to kind of bring in a skeleton staff and then ramp up using on-call or casual workers when needed, or they have the option to actually hold a little bit more HR slack. So a study came out that was published in the Academy of Management Journal in February just this year, and it demonstrated that when organizations are going through strategic changes, it's often best to hold more employees than you generally need, because those employees can be redeployed for strategic change and change management purposes, and they help to rally the troops when it's time for us to do a change. So I actually recommend that we actually bring in more people than we need, and we use those people in a capacity that we can start to manage that change. And this is not just banked in evidence, but I think that also financially we're incentivized to do that right now with the Canadian wage subsidies. So the cost of bringing in people is actually at a lower cost than it would be 6 months from now. So getting ahead of the curve is quite important. So HR planning is the first big broad challenge. The second challenge. Some of the conversations have already started. They started about this weekend in the media about recall and recruitment challenges. We have this expectation that people will come back to work when we ask them to come back. However, there's different things that are going to be impacting our ability to recruit and recall workers. The first is health concerns and employer obligations. So if we have an employee who actually has a health concern, then we might not be able to bring them back in the same capacity. We saw this in Quebec when they were talking about the teachers that are coming back. Teachers who are over the age of 60 or who have some immune compromised systems are not required to come back if they do not want to. So they're given that flexibility. Now's a good time also to reach out to your staff and identify who has a legitimate health-related concern. When we're trying to identify this, we have to be careful that when we're reaching out to our employees, we're also reminding them what the legitimate health-related concerns are. Fear of catching COVID under the Occupational Health and Safety Act as of now has not been deemed as an imminent threat. So it doesn't trigger the right to refusal as of now. It hasn't happened yet. However, you might want to be an employer of distinction and say, okay, well, if you're afraid to come back and someone else isn't, maybe I can work around that. So now's the time to think about those actions. Second thing that hasn't been really explored too much yet is labor force discouragement. So from March 15th to March 22nd, Statistics Canada went out and launched the labor force survey, which took a look at the flows into unemployment. And the flows into unemployment identified that there was 1.3 million people who had lost all of their earnings that week. So for that week, they had lost all of their earnings and they earned nothing. So they were actually technically unemployed. Then there was 800,000 people who were underemployed. And these people had lost 50% or more of their earnings, not quite to 0% though. So we had those populations. The other thing they found was there was 193,000 people who wanted to look for a job, but felt discouraged. And they didn't count in the unemployment numbers. So the unemployment numbers don't take into account those people who are discouraged in the labor force. HR theory and economic theory does tell us for labor force discouragement that people who feel that they cannot get a job are less likely to go and look for a job. So at this point, if there is someone in your workforce who you really think may be discouraged, but they're valuable to the organization, you want to be proactive about your talent search efforts. You don't want to send them out that mass email. Maybe it's a good time to trigger the manager to say, who are the key players in your organization who you want in your organization? Go out, reach out to them and move them from being a passive job seeker to being an active job seeker and bring them into the organization effectively. So encourage them. The last would be competition from CERB and social support. So this is the business person in me, it's the math nerd in me. But really what we're thinking about here is that if someone's making $2,000 a month at home from the CERB, in certain cases, that's more than what they're making at work. So they're making more by not working than they are by working. And in certain industries, so for example, retail and food and accommodations, those industries traditionally are low-wage industries. We also have certain low-wage occupations, so farmers or sales support people are low-wage occupations. For those people, it might be hard for us to bring them back. The math is simple for them. They just think about what their reservation wage is. So in labor economics, we call that job search theory. And it says that as long as we're getting social assistance, we actually inflate the value or the dollar value at which we will come back to work because we compare it against the social assistance that we're getting. And it's not until we start to exhaust our benefits do we then say, you know what, that number was a little bit inflated, I'll get myself back in check. So at this point, there are organizations that want to go and re-employ their workers, but they're having a hard time recalling them. And so that's one of the challenges that we're really facing is the competition from the social support that's being offered. Solution one I can recommend is to take a total rewards approach. People don't just work for pay. They need pay, yes, but people are working and work largely brings about these concepts of social engagement, meaningfulness in their work, the networking that they have at work. They like that sense of purpose. And so that's the total rewards approach, is that you're not getting the extrinsic reward and the financial reward. You're also getting these very valuable intrinsic relationships and rewards that you get, meaningfulness from your work and the sense of accomplishment. So we want to trigger and remind our employees that you're working for money, but you're getting these other benefits, which today, during quarantine and during times of social isolation, may actually be very valuable to your employees. Another suggestion I have, the second suggestion, is to focus on full-time reemployment. And I know that businesses get stuck. They think to themselves, should I bring back 3 people in a part-time capacity or 2 people in a full-time capacity? Given the competition that they're getting from social support and the need to mitigate risks, the need to minimize the amount of exposure we give our employees, I highly recommend that we go with full-time reemployment. So even if it was a part-time worker in the past, maybe bringing them on in a temporary full-time capacity can help you meet your needs while limiting exposure to the virus. So I think that this is exceptional. I do suggest that you have some limited part-time floaters and casuals. For example, if someone calls in sick or they're not feeling well that day, or there's a surge in demand, you could bring in some of those part-time floaters or casuals. But if you bring in a strong full-time contingent, I think that that would be the best strategy. I do think that if you are in a low-wage industry or a low-wage occupation, now's a good time to consider temporary wage increases. We see this with first responders, but I think that this also is important in the grocery industry, which has gone through hero pay and other ideas like that. So if you are going to give a temporary wage increase to incentivize your workers to come back to work and give them almost a bonus, a retention benefit here, then I recommend that you think about 3 main things. 1 is eligibility. Who's going to be eligible for this temporary wage increase? Is it only your minimum wage workers? Is it people who are making below a certain standard? How are you going to determine that? The second is be very clear about the time limits. How long will you offer this temporary wage increase for? And at what point will you reevaluate whether or not you need to continue the wage increase or whether you should stop it? So I do recommend that you have explicit, written out recommendations around the time limits for how long you will offer that benefit for before it becomes perceived as an entitlement. The third is you have to worry about internal equity. So in the grocery stores, if frontline workers were given a $4 increase or a $3 increase in their pay per hour, but their manager, who was only making $3 more than them, did not get the equivalent pay increase, then we might have a situation where there's perceptions of internal inequity. So one of the challenges here is that this creates an inflationary impact throughout the organization, because if we increase at the base level, our intro levels, then we also need to slightly make increases so the differences between levels are meaningful enough, and we don't end up disincentivizing our more senior employees. So you want to think about internal equity. The last is you want to provide some clarity on recall rights. So recall rights, this is some of the stuff that I've learned from employment law, and some of the lawyers who are on the call right now probably are totally understanding what I'm saying, but recall rights is this idea that employers have the right, if someone's been put on a temporary layoff, to recall their employees. And the employee has a responsibility to mitigate the damages against their job loss. And that recall essentially has been them being given their job back. If they fail to accept that recall, we can then assume that that is job abandonment. And sometimes educating your employees about the recall rights is an important consideration there, is that you can let them know in writing that this is the recall date, this is the job you'll be coming back to. And if you choose not to come back to the job, then we are under no obligation to hold this job for you and give you job security because we have offered you the job. And sometimes that does trigger it. So those are the kinds of competitions that we do get from CERB and some of the recruitment and recall challenges. And the last, honestly, I think at a macro level, we're looking at more unemployment. And when we're thinking about governance professionals, we need to be aware that our boards may not be prepared for more unemployment, some of the frictional things that are going to happen. And for HR, that means that we're going to be busier than we were before because we have so many more important things to deal with, and they're all competing for top priorities. What can we think about when it comes to more unemployment? Well, one is that under the legislation, at a certain point, the temporary layoffs no longer become temporary layoffs. They trigger into a dismissal. Sorry, they trigger into a permanent layoff, not a dismissal, my mistake. They trigger into a permanent layoff. And as they trigger into a permanent layoff, as that period comes to an end, we may be on the hook. We may be responsible for severance payments. We may be responsible for whatever bonuses and payments that we have for our employees at that point. And so if we're not aware, we're right now in Ontario, we're in week 7 or 8, and we're just beginning to open up a little bit. In Ontario, I think it's 13 weeks is for the temporary layoff. So at 13 weeks, we've got to get ourselves ahead of this curve and say, what are we going to do with these employees? It has been recommended by some of the legal counsel that I know that we think about if we're going to permanently lay someone off, we do it sooner rather than later to mitigate some of the risks and also give them the clarity that we won't have a job for you come 5 or 6 weeks down the road. And it's a good time for us to start thinking about that. I also anticipate more frictional unemployment, and I'm not alone in this. A lot of my labor economics researchers assume the same. And that frictional unemployment is coming from people having an opportunity now, a pause, a mindful pause that's been forced on them, but a pause nonetheless, to reevaluate their life. And a lot of people are making those decisions that they want to maybe feel inspired to be entrepreneurial. Entrepreneurs, on the other hand, might be making the decision that they value job security more than they thought. We might have people who are saying they want to be closer to home, but they're not happy at work. And we'll have those people who are triggering unemployment on their own because they're reevaluating their life. There's really very little we can do about that frictional unemployment, but being aware of that is important for us as HR and governance professionals. What I recommend is don't compare your turnover rates or use them as your benchmark when we think about what happened last year versus this year. So I know governance professionals are largely accountable for evaluating CEO and firm performance using those kinds of metrics. But this time is not like other times. So in the past, if there was an 11% turnover rate, and now we're looking at a 55% turnover rate of people not wanting to come back to work. So that's voluntary turnover. If we're looking at a voluntary turnover rate, that doesn't demonstrate that there's a retention challenge in the organization. It might just simply demonstrate that there are things outside of our control that the employees are valuing. At this point, I think it's important to also trigger exit interviews to figure out why people are not coming back to work. What's interesting for us, strategically speaking, is that the decisions we made about who stays on and who leaves or who gets to work from home, those decisions were all relatively hastily made as we were responding to the situation, and it unfolded quite quickly. But now's a really good time for us to also take that mindful pause and reevaluate which positions and jobs are core or mandatory to the organization. And beyond that, which employees are adding more value, which employees are actually going to be helping us recover the organization, and focusing in on retention efforts for those employees, and maybe thinking about permanent job breaks for the others. So that was a lot to digest. I do apologize, and it took me a long time to figure out how to linearly organize that. I hope it made sense. Ask questions if it didn't. Chris, I'll bounce it back to you.
Yeah, absolutely. No, that was, I think that was a fantastic kind of overview of some of the key challenges that we're going to face as we kind of move into the next phase for recovery. And one of the pieces that I made particular note of, and you brought it up in both the HR planning challenge as well as the recall and recruitment, and the idea of increasing the ratio of staff or adding employees as part of our early recovery plans is quite provocative, because I think there's a general assumption of reduction and maybe extending layoffs or being more prudent in terms of how we staff in our organization, prudent in meaning less rather than more. And I thought that was a very provocative commentary and perspective on how we plan and recall and recruit in our organizations in the early stages of recovery.
Can I jump in for a second?
Absolutely.
So that's also couched in this conversation that we're looking at which employees are adding most value and which jobs are adding most value, right? And as I said, we're incentivized, some of us, by the reduced labor cost due to the wage subsidies. So if there's a time for you to really think about what kind of training or redeployment or strategy you want your workers to be involved in, that's the time to strike.
Yeah, absolutely. Yeah, I think, you know, the planning and the mobilization and the management of our people is so front and center right now as part of these recovery plans. It's quite remarkable. So I know, you know, I appreciate you talking about some of those structural changes and some of the challenges we may be facing. Very big picture, very strategic. And I was talking to a colleague of mine recently who's the head of HR in her organization, and they have 2 corporate offices in Canada, and they have quite a wide retail network. And I was surprised when she told me they'd made the decision to keep their corporate offices closed until February 2021. And they really did it for two reasons. And one was they knew that the focus that they needed in the organization right now as the first stage of recovery was getting their retail network back up and running. And they didn't want the corporate offices to be a distraction from that. And the second point was the employee well-being and employee welfare. And employees were distracted and concerned about, when are we going back to the office? What is that going to look like? How am I going to be safe? How will I take care of my children? There was so much uncertainty around that plan. The organization just said, you know what? That's not something you have to worry about until February next year. Let's just focus on retail. So I wonder if you can maybe take us into the next part of your commentary about balancing employee well-being and the business needs in the short term as companies move into their recovery phase.
Definitely, and at this point, I don't think the blend between strategy and HR has ever been more important. So taking HR up to the strategic level is important, but we need those operational things that I'll talk about next also to help set the good foundation that we need. So what are the challenges? We know that these are the global challenges, but also things that we're required to do in the Canadian landscape. So one is physical distancing. How does physical distancing work in the workplace as we bring our workers back? Well, one is that you might consider redeploying your labor to limit your exposure. So these are called redeployment models because we might have a hybrid model where some people come into the office sometimes and they're not in the office other times. And maybe we have people coming in on Tuesdays and Thursdays, and that's group A, versus people coming in on Mondays and Wednesdays, and that's group B. When we create these work bubbles, these are teammates who work well together, who could socialize together, and we don't have to worry about re-sanitization partway through the day, or if there's an infection, mass exposure, we'll have limited exposure. So I do recommend that we take the idea of housing bubbles and bring them into the workplace to redeploy our works. It could be a 50-50 model, it could be a 30-30-40 model, but we can come up with models where we are limiting exposure by using a hybrid of working from home or physical distancing so we don't have everyone in the office at the same time. There's also a need to modify our workplaces. And we've seen some, I don't know if anyone else has seen it, but I saw some of the plexiglass dividers that are being used at restaurants. So two people could sit at a table and there's an H-shaped plexiglass divider. That's a great idea. But when do you need to order those? You shouldn't wait until the government tells you to open up. Now's a good time to reach out and start ordering those kinds of modifications to the physical workspace. Other teams I know are actually getting rid of some of that shared workspace. And they're saying that workspace that's shared, we're going to come up with alternative ways so we can still talk, but we're not physically getting into a conference room. And they're taking the conference room tables out and then just setting up micro individual desks in the corners. So 4 people can be in a room together, but they're not physically too close to each other. And that can build that collaboration, that real-time exposure that we need to solve some of these problems. The other thing we've seen a lot about is staggering schedules. Staggering schedules is great in theory because we can have people entering the workplace at different times, 8, 8:15, 8:30, 8:40. And as they enter the workplace, that reduces the rush at the front door. It also reduces the use of elevators. And oftentimes that also results in a staggering of coffee breaks and lunch breaks. In practice, we need to figure out who can come in when. So staggering the schedules requires an operational plan where we're actually keeping track of who's coming in at what time, and we're ensuring that that's something that will make sense for them. So that communication, that organization is something that HR and department managers need to be involved in. PPE, the time to order it is now. The challenge has been access to it, and that's been the universal challenge, right? There are places where we've got contacts and we've got help. So for example, Manitoba, which opened up quite aggressively, the Manitoba Construction Association actually had sanitizers that were available for their members, and you would order directly off of their website. When I was preparing the slide set on Tuesday, I could have easily ordered 2 or 3 jugs. Their limit was 3 as a non-member for an inflated price. And yesterday when I went to go and look at that again, they were sold out. So the time to get those supplies in is now. Order it now. Another thing you can do is also ask your employees if they have any contacts, or ask your network, ask the professional associations where their contacts are, because there may be mass availability of these things that you're unaware of. A lot of the breweries have switched over to hand sanitizer businesses, and sometimes it's just a question about trying to figure out how to get it and when to get it. But I suggest you start collecting it now. Beyond having the rules for PPE, we have to think about what we're going to do for non-compliance and who is responsible for this. So at the moment, a lot of us haven't thought about hiring on security people or redeploying our administrative staff. Rather than answering the phones or rather than doing some of the data entry, we can have them help out with some of the front desk spaces and help them out with making sure that the rules are being followed around PPE. We need to have clarity around what we're going to do if there's non-compliance. If we have a rule in place that everyone must bring a mask, what do we do if someone shows up without a mask? Do we offer them one? If we do, then what precedent are we setting, and why don't we offer it to everybody? Or is it a one-off situation? How are we going to deal with it, and who's responsible? This to me is quite compelling, and luckily I feel so happy that I'm in the Canadian landscape because, you know, there was the recent case, I think it was last week at the Dollar Tree, there was a security guard and he denied a woman entry in because she wasn't wearing a face mask. He's just doing his job. He was just a security guard. And the family went back and in retribution ended up shooting him and murdering him. And now there's a big lawsuit on that. Well, we have to think about not just protecting our workers, but protecting our security and the people who are implementing these rules. And we have to think about that very proactively, doing scenario planning and come up with a disaster plan associated with that as well, as scary as it is. Remote working. Again, we had to do this relatively hastily, but now we need to address some of the data protection issues, employees' mental health, and ergonomics. Not all employees are set to work remotely, and nor do they have the understanding of it. A few weeks ago, I was looking at the CEOs who are working remotely, and one of them actually had an ironing board as a desk. And they were up in the attic with an ironing board, and they were using that as their desk. And that's not ergonomically correct. When we're spending 30, 40, 50 hours at our desks, we have to make sure that we're following the ergonomic rules. Otherwise, we're setting ourselves up for some of the more compelling risks in the workplace. The musculoskeletal disorders, repetitive stress syndrome from reusing our body, and making sure that our employees have the right things that they need in the workplace. Employee mental health, it's a great time to start up webinars, but webinars are very much a pull model, where we're telling people if you want to come, you can come and join it, but if you don't come, that's okay. I think these need to be mandated within the meetings that we're having in the workplace. So extend a meeting that you're having that's maybe giving them an update to include a 15-minute chat session, to include breakout groups where they talk about what they're experiencing and rebuild those connections that can help with a lot of those mental health concerns. It's also great to reach out to places like CAMH and think about what kind of resources are available, but not just promoting them and finding them, but also encouraging your employees or putting them as part of the system of the meetings that you're already having. So forcing the employees to attend it when you've already got a captive audience may be an effective tool for you. The last thing that I want to say before we go to Q&A is all of this is really highly dependent on giving flexibility for any health and childcare demands. So health is really important for us. We don't know who's living with someone who may be compromised, who may themselves have had an issue. And we can't say to somebody who says that they've got a sore throat and body aches that no, that's not COVID because you haven't tested positive, come into work anyways. We have to be aware of all of the regulations around what we do and how we can limit exposure when people are sick. So now's a great time for you to develop your workplace accommodations plan. So think about, okay, if someone calls in sick and they need to be accommodated for 5 days, do we ask them all to go on short-term disability? Do we encourage them to take the sick period under the CERB? Maybe we need to revise our existing plans because our existing plans said they have to bring in a doctor's note. And for a temporary period, we won't be asking for a doctor's note on exit. Maybe we need to educate our stakeholders. So that includes our managers, our people who are interacting directly with our employees, and our employees regarding customers on the duty to accommodate. The biggest note on the duty to accommodate for you is whatever you do, be consistent. So if you've got someone who came in and said, I can't come back to work because the schools haven't opened up, and I need you to put me on a 3 to 11 shift so I can manage the kids during the day, someone else can manage the kids at night, that's fine. If you offer it to that one person, guess what? You have established the precedent that you need to offer the same kind of accommodation at some level or another to others as well. What I recommend for this is that you have a centralized accommodation policy where when accommodations are requested, certain information is requested, and there's a centralized pool or expert in your team who can review these and look for common themes and maybe be proactive about this, but ensure that in group A, one person didn't get an accommodation that in group B, someone did. So in that case, we have to be very careful. Consider flex time with core hours. Core hours means that everyone's at work for the same basic hours. So if you need to set up meetings, you want to set up collaborative opportunities, training needs to occur, it's all within the core hours, but people have flexibility before or after those core hours. It might be 11 till 2 are your core hours, it might be 9 till 12, and then people have flexibility to manage the rest of their day accordingly. And so I do think it's a good time now to reach out to your employees, to identify what healthcare concerns they might have, to identify how they're feeling, to identify if they've got some really interesting solutions. They're on the work floor every day. They might have been thinking about this for much longer than you have, around how the workplace can be accommodated and modified. So it's a great time to reach out to your employees now. And even if you have nothing to say, telling them that you're thinking about them and you're working on solutions and that you're excited that you might be able to bring some employees back will mean a lot to them. So with that, I want to give my cautionary notes. Act now. You want to empower your employees. You want to establish your checkpoints. I think you should reconsider some of your existing plans, and especially for the governance folks who are responsible for some of the strategy and evaluating that strategy, it's a good time to relook at the budget. The budget you passed in February is not necessarily the budget that's going to come through for the year. And we need to think about whether or not we're going to hold people accountable to those budgets and plans, and at what point those need to alter. Communicate, share your concerns. One of the things we forget to do in chaos and trauma is to celebrate. Celebrate the small stuff. Celebrate someone's 10-year anniversary at work. Celebrate someone's birthday. Celebrate it's a Tuesday. Celebrate. Find ways to celebrate, doing little rah-rah events, even organizing. I know another workplace that I know, it was someone's birthday. So they sent out mini Baskin-Robbins cakes to 5 people on their team. They met virtually, cut the birthday cake, and then everyone had their mini Baskin-Robbins cake. Little things like that really build that sense of camaraderie that we need to recover and build the energy that we'll need to recover. Evaluate, collaborate, consider. I think that I've covered all of these. So at this point, I'll pull it back to you, Chris. And actually, right before I pull it back to you, Chris, one of the things I want to remind our HR folks and our governance folks is you're not alone. You're not expected to come up with every solution alone. The fact that you're on this webinar is awesome, because it means that you're part of the conversation, but you're passive in this conversation right now. Reach out to people, reach out to the GPC, reach out to the HRPA, reach out to me, reach out to 3 other people and ask them what they're experiencing. And one of the things I really struggled with at the start was I thought social isolation was like mental isolation from people. I wasn't sharing ideas, I wasn't collaborating with people. And I got very confused about physical isolation versus social isolation. And since then, we've seen the dialogue change, that it's now physical isolation. So don't forget to trigger in and ask people questions. If someone can't answer your questions, maybe they'll know someone who can. So with that, Chris, I'll leave it to you.
That's great. I appreciate that kind of thought there at the end, Nita, because I agree. I think we all just said, well, I'm cutting myself off from the rest of the world because I'm social distancing. And then you realize, okay, it's very lonely in a social distancing environment.
And it's unhealthy. You can't come up with solutions by yourself.
Well, exactly. And I think your cautionary note or your great advice to celebrate things and look for those silver linings and those opportunities to just, have a joyful moment. It goes a long way in terms of mental health and employee well-being. I wanted to ask you a question, Nita. You talked a little bit on it in that last section about accommodation and some human rights considerations. And how would that relate to the recall rights when you were talking about recalling workforce and employees' rights or potentially abandoning? And what should employers and HR professionals keep in mind if they're recalling a workforce, but we're also balancing accommodation? Do you have any thoughts on that?
I do recommend that we take a look at this on a case-by-case basis. So we don't have a blanket thought on that. I know family status was something that was brought up in 2 of the more recent cases. I believe Sealy was one of the big ones, but family status is a need for accommodation. But it's not just, do you provide the accommodation? It's the question about, is that accommodation provided consistently? And is that accommodation considered something that is to the point of undue hardship? So those are the kinds of challenges. I know another organization where they recalled an employee, and the employee said, I don't feel comfortable coming into work because my spouse has severe asthma. And they understood that, but said, we need you in the office to help lead these teams and to help do various tasks. So we'll give you a private office. And we'll come up with an accommodations model where you're coming in 3 days of the week, and we'll ensure that you have all of the requirements that you need, the personal protective equipment. And so in this case, we really have to think about it from a shared responsibility approach. The employees have to mitigate their risk too. If you recall an employee and they can't come back because of their own personal health related reasons, that is frustration of contract. They can't come back to work. And at that point, I would often trigger into some of those fantastic employment lawyers who can talk to more of the recent cases, and they do a fantastic job with that.
Yeah, absolutely. And even as we plan and you know, I work in an office environment, and I'm sure a lot of our audience does. And so I'm going to speak to that particular experience. So when we think about opening up offices again, even with work bubbles or varying work schedules, I think it's prudent for HR professionals and organizations to ask, is now the right time? Just because we can do, should we do? And making that part of the dialogue as we work through our recovery plans as well, because I'm, you know, in a macro sense, I'm concerned about, I work in Toronto, and I just have this picture of, you know, still a mass commute and a mass kind of rush of people back to the office. And so I think we have to maybe create an employee persona in a way and imagine ourselves as that employee commuting to work, going up the elevator, having breaks, going out and buying lunch, and what are all of the areas where they're going to interact with the general public or interact with others that we may have to think through from a risk management perspective.
Right, and I think we've got this spectrum of mental health that we need to consider too. So some people really want to come back to work. For them, being away from work is causing all sorts of strife, right? And those are the raging extroverts, people who need that. But then on the other hand, we have, there's a small restaurant in Toronto, so I'm in Toronto as well, called Le Petit Déjeuner. And they came out this morning and said, we're actually not opening up, even though we're allowed to open up, because we are stressed. We've been working 7 days of the week trying to keep things clean. We're at the point of breaking mentally. So we're not going to open up right now. We're going to take another month off, and we will open up in the future. And in that case, they did a good job because they reached out to their stakeholders in a very compelling way that said, we're not going to risk our individual mental health in order to provide you with breakfast. This is something that we will do at a later point, but it brings forward the conversation about mental health in a very healthy way.
Yes, absolutely. Very responsible of them for their employees, but also for the general public. I think it's a powerful message for them to do that and make that decision. I just want to remind our audience that if anybody does have questions, they can use the chat box and send in their questions for Nita.
I see one question from Kelly around the slides. I think that we can make those available.
Okay, wonderful. That's great. Thank you. So yeah, we'll get the slides out following the webcast. I did have another question that, about, you mentioned it about kind of stakeholder education and establishing rules, even temporary rules around returning to work. And I don't know if it's more of a comment or a statement, to be honest with you, but I've heard things like considerations about, you know, demanding declarations from employees that either they are cleared, they haven't come in contact with the virus, they're showing no symptoms. Our employers and our organizations, is that within their rights at this time to demand those declarations from employees before they return to work, or temperature checks upon entering the office, or, you know, some of those, I guess, procedural changes that we would look to make in the short or midterm even. I mean, it could be another 15 or 18 months before we see a vaccine available. So
I think that it's within the employer's right, because what they're doing there is that employers have the right to provide a safe workplace for all. And so in that case, it's not that we're protecting necessarily the employee who's wearing the mask, it's that we're protecting others from potential infection. And so in that case, it's something that we really wanted to bring up. But when we're thinking about temperature checks, we have to worry about how invasive that is too. So are these things being used in a randomized environment, or are they things that we're standardizing? Recommendation is to standardize these, right? Because then that way you're not bringing in any discriminatory claims. The other thing too is how invasive are these? So if these aren't invasive, that's fine. We can have a temperature check. And again, we have a policy on that and then we communicate that effectively. We need to have a program in place about what we would do if someone says, no, I don't want that temperature check. Or what we would do if someone says, well, okay, I came in at 99.9. Yes, it beeped twice. I do have a high temperature, but I'm fine. Let me come into work. Do we send them home with pay? Do we send them home without pay? So those kinds of questions are really coming up a lot. And you have to build in that consistency. The second you add in randomization or inconsistency, we are exposing ourselves to potential discriminatory actions because people will say, why me? But it does align with the responsibility to protect our workers.
Yeah, absolutely. That's great. Yeah, because again, in my experience and now that we're starting to get, even from some of the members of the Human Resources Professional Association, these are the types of questions that we're seeing come in and the types of concerns in terms of short-term planning for recovery. So I see that there's some questions.
Can I just address Zach? Zach, I can definitely send out the Excel spreadsheet. I'm going to update it because of what happened with BC recently, but I'll send that out. When it comes to Patricia, she's asking, how do you suggest we address the safety of field employees or representatives who have to go from one place of work to the other? A couple of solutions that we see. So for example, in Alberta, what they did was the health inspectors would be at the highest risk level. So the Alberta workplace health inspectors. And people would call in, employees can call in and say that my employer is providing an unsafe work environment. Their standard protocol was then it would switch to a video investigation. So the employee would then bring in a representative of the union and a supervisor, and then they would do a video investigation where they go through the site and they actually showed, well, this is what's right, this is what's wrong. That didn't come to light until there was a failure in Cargill where an employee had called in, but there was a failure because the inspector did fail to recognize that there was a mass exposure level there. But that's one option, is to switch to going to video. Another option is the safety of our field employees. Safety and protection from COVID, let's recall, comes from basic principles of washing our hands, of keeping 6 feet apart, of making sure that we have sanitizer and personal protective equipment available. I would see nothing wrong with sending out an employee to a site if they have all of those tools available, if they have a hand wash station available, if we've given them the wipes that they need, if we've given them some of the tools that they need to go on site. We see this with construction workers right now who are out there. They've got plexiglass shields in front of their face. So as they're out in public, it's not only protecting them from the elements they're dealing with, but from the people they're dealing with. So that's one of those really interesting pieces when it comes to COVID, is that the solutions are actually quite practical. You know, wash things, wash your hands, keep clean. They're hygienic-based solutions, keep a distance. Those are things that we could practically implement. So Patricia, I hope that answers one of your questions.
That was great. I think maybe one more question. We have time for one more question from those that have sent in. And if you put in a question and we didn't get a chance to respond to it, just remind you that we'll be able to respond or send out responses following the webcast. So here's an interesting question from Garnet Garvin. So do WCB or WSIB recipients have return to work priority?
Not that I know of.
Yeah.
Right, so I don't think that they have priority over return to work. Return to work is a program under occupational health and safety, but it's not necessarily under the layoff regulations. And the layoff regulations are largely provincial. So I'm comfortable, I could probably speak about 5 or 6 of the provinces. And so that would come down to your provincial. But from what I understand, I don't think that they have special priorities, whether someone is sick or whether they've been on short-term leave. They have equal opportunity for recall, but that would be based on company needs.
Absolutely. And assuming their employee readiness to return to work as well following their workplace injury.
Right.
Well, thank you, Nita. But I think I could probably go on for another hour quite easily on the topic. I've really enjoyed your presentation, and I'm going to pass it back to Lynn now for a couple closing remarks and to wrap us up.
Thank you. Lynn, I think your mic's off.
Albert, oh, thanks, Albert. Okay. Yeah, thank you so much, both of you. And I was just laughing because I could hear the construction right out of your window. So you weren't kidding about that. Again, thank you for your insights, Nita, and for the work that you put into this presentation, and Chris for facilitating this discussion. You know, you both put a lot of work into this, and your enthusiasm, and it was really appreciated, your combined expertise on these challenges and the insights. You know, I gained a lot myself. And I hope everyone here has gained great information as well. And as Chris mentioned, if you have any further questions for either Nita or Chris, we will be taking those off of the chat and making sure that, they have an opportunity to respond and post them on our new page, which actually I'm really pleased to share with you. We have just posted on the GPC website a new COVID-19 resources page and advisory expert panel. And to Nita's point, you need to reach out when you need answers. And this is what we're trying to accomplish with this governance assistance page, which will be a resource and support center. Well, you'll find all of the recent COVID related webcasts, replays, including this one, relevant articles, links, and useful resources. And this page will also give you access to a unique gathering of leading experts and practitioners in various governance related topics and HR. Nita and Chris have kindly agreed to participate in this, and this panel is assembled to help you with your key questions and challenges. I'm just going to share my screen and see if I can find it for you. All right, it's not appearing, but yes, I mean, what we definitely would like to encourage everyone to check out the page on our GBC page, which is gbcanada.org. And it's important now more than ever, obviously, for governance professionals and other professionals and organizations who have these challenges on their plates to keep up with the changes in this fast-paced environment, and to ensure the most effective and reliant processes are in place and best practices are taken into consideration. So we'd like to encourage everyone to join GPC as a member so that you can tap into our resources and connect with our community of governance professionals and access our many benefits. So thank you again to Nita, to Chris, and to all of you for attending our webcast today. And I hope you all stay well and safe. Thank you so much.
Thank you. Bye.
Bye-bye.